Well, I have to note that there's something that's very weird going on in this country and in media, and that is the sense that things are constantly getting worse with regard to COVID when the evidence that things are getting worse with regard to COVID really is not spectacular. And what I mean by that is obviously we've seen more deaths over the past month. There's just no question. I mean, we've seen more infections over the past month. But as a percentage of infection, deaths continue to decline. As a running tab in terms of hospitalizations, deaths continue to decline. Hospitalizations have started to decline in places like Arizona, Florida, and Texas. And it is also worthy of note that other countries are now experiencing unrest in the streets over lockdown. So all of the talk about how in the United States it's all red state, blue state kind of stuff, only these evil conservatives want to stop the lockdowns and reopen the economy. They are literally having mass protests in the streets of Berlin over the lockdown. In Israel, they've had mass protests in the streets over everything from unemployment to lockdown. Specifically targeted lockdown against religious communities is one of the implications. This sort of stuff has been happening all over the world because it turns out that when you lock hundreds of millions of people indoor for months on end and tell them that in order to be safe from a virus that largely kills people who are above the age of 80, most people who are young are not going to abide by that. And most people who are young are going to start going out again. They're going to start participating in everyday life again. And let's be real about this, they probably should. If you're 20 years old, there is no reason for you to stay home other than you're afraid that you're going to infect grandma. That's pretty much it. And that means that when you visit grandma, grandma should wear a mask, and you should wear a mask, and you should socially distance. And that's all. And the notion that large numbers of young people are in danger from this or dying from this, it is not statistically true. And I get the sense that there is this real gap in the American level of panic about this thing and the actual facts on the ground about how deadly this thing is. I think that if you asked regular, everyday Americans, how many people out of 1,000 who get COVID do you think are going to die of this thing? The average American would probably tell you out of 100 people, 10 will die. Out of 1,000 people, 50 to 100 will die. And that's not true. That is not true. If you are under the age of 25, you are not dying from this, statistically speaking. Okay, if you are under the age of 55, you're almost certainly not dying of this, statistically speaking. In fact, in the United States, we've seen something on the order of 150,000 deaths. When you break it down by group, I was talking with somebody who was actually a member of the group that wrote the CDC guidelines over the Shabbat weekend. And this guy was saying that the average age of death in the United States from COVID, and this is true according to the CDC, the average is 80, which means that half of the people who have died of this are above the age of 80. Half. Okay, and the truth is that nearly everybody who has died of this is above the age of 70. Okay, the CDC puts out these stats regularly. And here are the stats that are the latest stats. This is from late July in terms of absolute number of deaths by age group in the United States. And this would be out of a total of some 100,000 deaths that were reported to the CDC as of like mid-July, because there's been, again, this uptick over the past few months, and there's late reporting. Okay, so this is out of maybe 100,000 deaths that were reported to the CDC as of mid to late July. Hey, if you're under the age of 25, out of those 100,000 deaths, there have been 1,236 deaths. Okay, if you're under the age of 25, in a population that probably has 100 million people under the age of 25, there have been a grand total of 14 deaths below the age of 5. There have been a grand total of 23 deaths below the age of 15. So we are not talking about large numbers of young people who are getting this and dying of this. Nor are we talking about large numbers of young people between the ages of 25 and 34 who are dying of this. There have been a grand total of, again, according to the CDC, and there's out of about 100,000 deaths that were reported as of mid-July, there were 200 deaths, age 25 to 34. And when you look at the curves from the CDC in terms of actual numbers of overall death in these age groups, COVID represents an extraordinarily small percentage of the overall number of deaths in these age groups, which is why, if you look at the flu, you should be, if you're a parent, you should be much more scared of your kid getting the flu than you should about your kid getting COVID. No doubt. And without a doubt, like you're 16 to 20 times as likely to die from the flu if you're under the age of 5 than you are to die of COVID, which again, should not be a surprise. We've known this for a long time. And this is why it's so maddening when you see our experts say things like, well, you know, it's true that mostly old people are getting this, but it could happen to anybody. Statistically speaking, it really can't. Statistically speaking, the people who are dying of this are generally older, which means you protect those populations. And then if you wish to reach anything like herd immunity, what you actually want is not to shut down the spread. You want young, healthy people to actually get it over time if you want to reach herd immunity. And I know herd immunity became this sort of bad term that you're not allowed to use anymore, because we're all supposed to sit around waiting for the vaccine. But that was always a foolish notion that herd immunity was completely off the table, especially Because again, we can look back at Sweden. There's a lot of talk about Sweden was going for herd immunity. Look how badly they did it. Okay, Sweden never locked down. Sweden actually saw a GDP growth in their last quarter. And Sweden now has a declining level of cases and nearly no death. Why? Well, because it turns out that the herd immunity rates to this thing may not, in fact, be 70 or 80% as originally supposed. It may be as low as 20 or 30%, because it is possible that a lot of people have T-cell immunity, meaning that if you had a cold in the recent past, you have a certain level of immunity already built up to COVID. It is maddening when you hear experts say things. I mean, and Anthony Fauci will say stuff like this on national TV. He'll say, well, it's true that this is mostly affecting older people. Young people can be hurt by this too. Okay, well, it is true that death mostly affects older people. Death can affect younger people too. There are lots of things in life that also affect younger people. Irritable bowel syndrome affects younger people. It is also much more prevalent among the elderly. The question is not, can a bad thing happen to you? The question is, what are the chances of the bad thing happening to you? And that is the thing that we should be focused on, but nobody seems to be focused on that right now. There's a Swiss study of seroprevalence trying to figure out what exactly the infection fatality rate was of COVID by age. And what it showed is that if you're under the age of 10, you're basically more likely to be struck by lightning than to die of COVID. If you're below the age of 20, same thing is true. Even if you're looking at the generalized overall COVID death rates, the infection fatality rate, so the CDC is now estimating that the infection fatality rate could be anywhere from 0.2 to 0.6, which is something I've been saying for literally months, pretty much since this started. Even if you take the upper end estimate, 0.6, I think people don't understand what that means. That means if 1,000 people get COVID, 994 of them will live. Now, that does not necessarily mean that everybody who lives is going to be completely undamaged by it, but we don't actually have the data on how many people are damaged or what the damage looks like. So instead, we see these anecdotal horror stories of people who have zero lung function, or we hear these kind of vague statements that people will have heart damage, but we don't know how much heart damage. Okay, that's panic porn. It is. If you don't have hard data, that's panic porn. And panic porn sells papers, and it moves clicks. But panic porn is not good for your brain, and it ain't good for your soul, and it doesn't allow you to calculate on an everyday level what sort of risks you should be taking as a responsible human being. Frankly, it is maddening that we have continued to act as though this thing is equally deadly for all age groups and that everybody should be treated equally in the population in terms of lockdown. It doesn't make any sense at all, like none. Again, the fact is that this is disproportionately affecting elderly people because elderly people have more underlying conditions and are more likely to die, period. And the fact is that if you look at death from all causes among people who are above the age of 85, death of all causes between essentially February 1st and July 25th. Death of all causes, if you're over the age of 85, 467,000 people died in that period above the age of 85 in this country, and 44,000 of them died of COVID. Okay, what does that mean? It means a lot of people died of COVID above the age of 85, like a lot. In fact, that's the single largest population group in terms of who died from COVID, is people above the age of 85. Out of the 6.5 million Americans who are in that age group, some 44,000 people died in that age group. And it is by far, by a plurality, the largest age group for death. That doesn't mean that each one of those deaths isn't a tragedy. It means that when you're trying to figure out who goes back to work, 85-year-olds are not the ones who are staffing the workplace. Now, again, if you got underlying conditions, if you've got obesity or diabetes, then maybe you should think about distancing and wearing a mask and doing all the things that you should do. But if you're younger, I think that all the talk about how we can never talk herd immunity, I don't know what everybody's plan is. I'm not hearing a plan. And if the plan is wait for a vaccine, that plan has some holes in it. It has some serious holes in it. Okay, so in a second, we're going to talk about the wait for a vaccine plan. We're also going to talk about what's happening in Arizona, Florida, and Texas, where we were hearing doom and gloom. Everyone was going to die. And it got pretty bad in terms of the deaths per day in places like Florida, Arizona, and Texas, and now they've hit the downslope. We'll talk about also how this does not correlate with lockdown. It doesn't. Okay, the notion that lockdown saved these states, California never stopped locking down, and California has had the latest peak of any of these states. It turns out these states were not experiencing a second wave. They never experienced a first wave. They were just experiencing the first wave. And now the question is, if there even will be a second wave, depending on how many people actually got this. The panic, is this a moral panic at this point? It may well be. That doesn't mean it ain't dangerous. It doesn't mean it ain't real. It's dangerous. It's real. You should take precautions to make sure that people who are vulnerable don't get it. But we are now making risk calculations not based on any hard data. We're making risk calculations based on the panic porn put out there by the media. And yes, by some public health experts whose literal job, like a lawyer, I've acted as a lawyer. Your job as a lawyer is risk mitigation. You go to your client, you say, here are all the risks right, in your business. And we need to take care of all of those risks. If you are a quote unquote health policy expert, your job is to mitigate risk to human life. And if that means scaring people, then you scare people. And if it means kind of overstating the case a little bit, then you do that too. But you're never asked to take into account the countervailing problems with locking down entire societies, which we'll discuss in just 1 second. Again, all we heard for literally months was Arizona, Florida, Texas, we're all going to die. It is just as big. It's like New York. It's like 12 New Yorks. It's a bunch of New Yorks all over the place. The hospitals are going to be overwhelmed. Well, now it seems that is simply not the case. It seems that we may be looking at the basically the end of this thing in Florida and Arizona and Texas, at least for the moment. We don't know what's going to happen come the fall. But again, it's hard to see how the spread is going to be much more dramatic than it just was in Florida, Arizona, and Texas. So here is a chart. Okay, the chart shows you what happened in New York versus what happens in Arizona, Florida, and Texas combined. Anybody who compared these places is being an idiot. That solid line right there is the number of deaths. You can see a blue solid line for New York, and it goes sky high, all the way up to number of deaths per day per million. New York went up to like 40 deaths per day per million in the state. Arizona, Florida, and Texas combined never went above 10. Never. Okay, so it was never like New York. It was never like New York. You can see New York just got overwhelmed. New York got hit really hard. And more than anything, New York did not protect its elderly homes. And that meant a lot of elderly people died. Because guess what? Elderly people are the people who are mostly dying from this. Again, the number of Americans who have died of this disease total under the age of 55 in the United States, at least as reported as of mid-July by the CDC, under 11,000 out of 100,000. And this is a disease that is mostly killing elderly people. That does not mean it's not dangerous. It doesn't mean don't be careful for the 1,000th time. Okay, so Florida and Arizona and Texas, you've also started to see the cases come down. You go back to that other chart for a second. You can see the dotted line. There's a red dotted line. And what the red dotted line shows is cases. So you can see New York spiked. It looks exactly like the curve you didn't want. So New York spiked. It spiked in terms of cases and spiked in terms of death. And then you can see on that red dotted line, Arizona, Florida, and Texas, they spiked in terms of cases. And they kind of gradually rose in terms of death. And now, presumably, all of this will start to recede as the trailing indicator that is death, goes up a little bit, and then it'll start to come down again. This is all courtesy of covidtracking.com. And then you can look at the second wave up. You can also look at when you compare cases and deaths on the same scale and axis. So here is the media telling you, exactly how bad things were going to be in terms of cases and deaths. You can see the deaths remained extraordinarily low throughout, right? They have remained very, very low throughout. The cases created this huge mountain of cases, mainly identified cases. Lots of asymptomatics were being identified here. Lots of cases that were not particularly dangerous. And I think here we should note that there is this weird tendency out there to think that if a person who's 30 gets COVID and then recovers from it, something bad just happened. If a person got COVID and they're 30 and they recovered from it and they're not harmed by it, an extraordinarily good thing happened, not just for the person, not just because they're Superman and can walk around, but also because that person is no longer capable of carrying the disease. The way that you approach herd immunity is by making people not able to carry around the disease, not to be vectors of transmission. Now, you can see here, by the way, on this chart, again, courtesy of covidtracking.com from and Weiss, who does a great job putting these charts together. You can see exactly how the lockdowns had no effect in Arizona, Florida, and Texas. And then as soon as the protests began, you can see the thing starts to spike. Right? The lockdowns kicked in late March. Okay, the case load had already started to rise a little bit. It basically was flat. Then the reopenings happened at the beginning of May. It completely stayed flat. Then the protests happened at the end of May. And then, literally 2 weeks later, the number of cases starts climbing. So for all of this talk about how the protests did nothing, it turns out that also was not true. Also worth noting, there are certain states that never reopened, and they're having spikes in cases. Hey, Hawaii had a huge spike in number of COVID cases per day per million. Hawaii, okay, they've shut down travel. You literally cannot vacation in Hawaii. And Hawaii it's an island in the middle of nowhere. They've had huge spikes. You're starting to see spikes in Alaska. It turns out that basically everybody's going to get hit by this. And the only thing you can do is protect the vulnerable, which, by the way, was the recommendation in terms of policy that I've been putting out there for literally months. I mean, I had a full episode devoted to the idea of what two Israeli scientists called controlled avalanche early on. Their suggestion was, if you're going to approach herd immunity, the way you approach herd immunity is you actually want people who are younger to get it and not pass it to older people. If you're a part of a non-vulnerable population, it is a very good thing for you to have it. Not on a personal level, obviously nobody wants to get sick, but in terms of approaching herd immunity, just in the same way that a vaccine, look, you may never get the disease that you get the vaccine for. The vaccine is an attempt to prevent you from becoming a vector of transmission for that disease. And that's why people have vaccinations. The same thing holds true when it comes to herd immunity and getting something like COVID. This doesn't mean you should willy-nilly go out and have COVID parties because, again, we don't know all the risks at this point. But here's the reality of it. As this thing makes its way through the population, there's no way to stop it. And anyone who is telling you that there is a clear, obvious way to stop it is wrong. Japan is seeing a spike in cases right now. Japan has extraordinarily high levels of both masking and of social listening. People who obey the rules, basically. And they're seeing spikes too. So what that means is if you actually want to have at any point something approaching herd immunity, how about this? How about we tranche back in the populations that are most healthy, and we protect the populations that are least healthy? And you know what that would include? Opening the schools. You know who are the healthiest populations? Kids. So if kids all get this and pass it to each other and don't kill their parents, which, by the way, we have not seen a lot of evidence of transmission from kids to parents. There's one lab study that came out over the weekend suggesting that kids can pass it and have the ability to pass it, but there are studies in Switzerland and Iceland and Australia and Sweden suggesting kids are really not passing this thing very much. Okay, then schools are actually a great way of taking an entire population off the table as carriers of the disease with the ability to pass it. It's not a bad thing. Meanwhile, the experts continue to act as though panic is warranted. Concern is always warranted. Concern is always warranted, but panic is not warranted. And they're putting out not great information. So, for example, Dr. Fauci, who, again, I think he's doing the best he can. I think the man is an American hero for his work on HIV. I also think that his assessment of the situation throughout has been dicey. I think he has made mistakes for sure. And I think that the fact that Fauci will say things like, we need to lock down harder, while simultaneously refusing to answer questions about protests that probably seeded huge increases in places like California, there's something overtly political to that.